you for joining the Phia Group for another COVID-19 webinar. Again, we did have a very well-attended presentation last week. We thank all of you who were able to join us. For those of you who were not, that webinar audio and slides are available from our website. Additionally, those who are attending today will also receive a copy of this webinar. And again, we thank you for joining us again today. Obviously, I am on all the same emails as you. And I've been receiving invitations to the many different webinars regarding this topic, and it's difficult to attend them all. We appreciate that you've chosen to join us for this one. That being said, all of the information shared throughout these different presentations I think are very important, and I think it behooves us to serve as a think tank together as a community, as an industry, share information, and work together to address this current issue. So again, thank you for joining us for another Phia Group webinar regarding COVID-19. The CARES Act and Workplace Safety FAQs will be our focus for today. We can proceed to the next slide. Now, webinars and podcasts and articles, we do the best we can to keep everybody informed, but ultimately there will be new questions, new concerns, things that are bugging you and that have not yet been answered via those resources. For those questions, concerns, ideas, thoughts, theories, and frankly, anything else, we urge you to contact us at pgcreferral@phiagroup.com. That's pgcreferral@phiagroup.com. You do not need to be a Phia Group client for any services to utilize this email address. We are happy to receive any and all communication via this email address, and we will strive to respond ASAP. And I think together we can come up with some ideas and discuss some issues that maybe other people have not considered in the past and stay ahead of things. If you are an ICE client, that's Independent Consultation and Evaluation Client, you can use this email address. However, you also, as always, have access to your ICE address. You know what I'm talking about if you are an ICE client. For those of you who are not, we will cover that during today's presentation as well. Thank you to our ICE clients and to everybody. Please do feel free to reach out. Next slide. So today, here are some of the topics that we'll be covering regarding both the latest on the pandemic, some regulatory and legal responses, and also covering in a little bit greater detail matters of workplace safety. And who will be presenting today? Well, let's proceed to the next slide. Well, that's me up in the top left corner, Ron Peck. I am Executive Vice President and General Counsel of the Phia Group. To my immediate right, at least spiritually and for purposes of this webinar, but certainly not physically, we are once again telecommuting, coming to you live via satellite from many different remote locations. And one person who will be communicating with us today from, likely she's locked herself in a bathroom somewhere, is the Queen of Consulting, the Countess of Compliance, Jennifer McCormick, Senior Vice President of Consulting. Also coming to us, hopefully his audio will work. I know it's very difficult to communicate via telephone or any other telecommunication when you are buried many feet underground in a bunker, is Director of Legal Compliance and Regulatory Affairs. And special guest, I love that, special guest. I hope everybody else feels a little bit less adequate, or should I say less special, when we have Philip on the line. Phil, who is really our sort of HR guru, where sort of the crossroads between consulting and legal issues and HR meet. And he will be talking in greater detail about some of the issues that are impacting us, not only as service providers, but employers. People in the industry of employment in general. Employee benefits is just sort of one facet of that overarching industry. And he will also be introducing himself to you today as well. So quite a treat. Next slide. So for those of you who are not familiar with the ICE service, this is a service that we've been providing for some time. I wonder if it's a misnomer to call it a service. Certainly our consulting services regarding these and many other topics are available to really all takers. I had mentioned PGC referral at phiagroup.com as your resource or avenue to obtain these services on a case-by-case basis. But for those who are looking to access the information that we have, the researchability of our people, our professionals, on a regular, ongoing basis, ICE is a service by which you pay a regular capitated fee, and it provides you with unlimited access to our resources. So again, something to take into consideration is the ICE service. For those who are interested, of course, you can always reach out for additional information. And we also introduced Phil, and if we'll go to the next slide, adding on to ICE is now the ICE Plus service. This is sort of the next level or evolution of the ICE service, where we are adding on additional consultative services regarding things that relate more to employment issues and employer-employee issues, sort of expanding beyond the boundaries of just the health benefit plan. And like I said before, Phil is really a guru when it comes to this, and we would encourage everyone to contact us at info@phiagroup.com. Obviously, the type of situation with which we are dealing today, the COVID-19 coronavirus pandemic, is a terrible situation. None of us are happy to see it, but I do feel fortunate to be able to say that we I think started to look into providing additional information and resources regarding things that ended up being very relevant without knowing that this was really coming right around the corner. So please do take advantage of these opportunities that we are presenting today. Lastly, next slide. Even if you're not using ICE or ICE Plus or sending questions via PGC referral at phiagroup.com, I do encourage you to follow us on LinkedIn, where we will continue to post articles, updates regarding both the pandemic, the impact on the industry, responsibilities of the industry in response, legal updates, and just general information and news that are relevant to all of us. So please do follow us on LinkedIn to obtain that information as it becomes available to us. Next slide. Now, Brady is normally responsible for the graphics in our webinars, and he assigned this slide to me. And I must say, looking at this slide, it seems pretty dire, Brady. I don't know why you would assign this one to me, almost as if it's my responsibility to create panic. And of course, you can see that very bright red spot up in the Northeast, and we're right in one of those circles there over by Boston. But of course, this is not a Northeastern issue. I think what this map represents is that it really is affecting every state. Additionally, recall that even though you may be servicing employers in one geographic location, there are two additional things to consider. One being that they may have satellite offices or employees in another geographic area. So for those of you with plans in South Dakota thinking, that's not too bad, you don't know where those other employees are located. Additionally, those other states and employers that are being more heavily impacted today, what expenses they incur, what costs they're dealing with, what resources they're consuming, and what regulations and laws are passed as a result will have a trickle-down effect for everybody. So again, when you look at, for instance, New York, obviously a hot spot right now for this disease, to think that, well, I'm out in Wyoming, so that doesn't affect me. If at the federal level they pass laws or regulations in response to what you're seeing there in the Northeast, at the federal level, it will impact everybody. So it's extremely important to keep those things in mind, even if you don't think geographically you're as deeply impacted. Next slide. Another national impact is some of the rhetoric or political editorials that you are reading today in response to what is happening. There are those who are looking at what's going on right now as an opportunity to promote or push for Medicare for all. And really that argument comes in a few different flavors. Again, it's important to look at other nations that have been impacted by this. And it appears that in most cases, the nature by which healthcare is paid for has less to do with the success or failure in combating this disease than the actual quality and availability and access to healthcare in the first place. So that's one thing that I think maybe is pushback against this argument that if we had had Medicare for all, the impact would have somehow been less. Again, unless Medicare for all improved the access or quality or really just the volume of care, and by that I mean supplies, devices, and such, it's hard to argue that that would have the impact in right away. That being said, there are those who argue that because people have such high out-of-pocket expenses, because they can't afford insurance and therefore can't afford health care in general, maybe they were sick and opted not to seek treatment early on. And those people who maybe they had, some of the symptoms, they would have been treated, but it was not so severe that they didn't need to be rushed to the emergency room, became carriers. And that if people had felt that they had less expensive access to health care universally, that maybe we could have nipped it more in the bud. Again, hindsight is 2020. It's hard to say whether that would actually be the case or not. Remember, many people who spread this very quickly are international travelers, business people attending conferences, and so it's not what you would usually consider to be people who can't afford coverage. Indeed, most of those people are actually traveling as part of employment and are covered via employment. But that brings up the next argument. You're starting to hear some arguments that because of the impact on the economy and the soaring unemployment numbers, the increased number of people without work will equate to an increased number of people without work-based health benefits. And as a result, Medicare for all would not have prevented the pandemic, but instead it will hinder our ability, the lack of Medicare for all that is, hinder our ability to respond to the pandemic because so many fewer people will have coverage. And that's really, I think, one of the important reasons why we're talking today, that we're discussing these issues today, because we are looking at not only what an employer's responsibilities are to current employees, but to past employees, to furloughed employees, to employees who are on leave, who are seeking extended benefits. That, I believe, will at least enable us to deal with some of the issues about which I just mentioned. And speaking of issues, let's go to the next slide and talk to one of the biggest issues I have in my life, that being the man, the myth, the legend, Brady Bizzarro. Brady?
Great. Thanks, Ron. We've got some issues to talk about here in terms of the response to everything Ron just described that's going on. I'll get to this in a little bit when I talk about the CARES Act, but some of the things the government's doing is meant to prevent a lot of these layoffs that we're seeing and the furloughs and unfortunately seeing businesses have to close. But before we get there, I want to talk about a few high-level things we've seen from the government in terms of responses that are in the news recently. So yesterday, the administration announced the extension of these social distancing guidelines until at least April 30th. And look, not to be too grim, but according to the health advisors, the doctors that are advising the president, they're projecting that we could see up to 200,000 deaths in this case. So this is a real serious pandemic, obviously. There's a new aspirational date that's been set of June 1st to hopefully get companies back up and running on a wide scale. But the curve is not looking so good at the moment. And the point of all of us being hunkered down is to try and fight that, as everyone knows. One of the things that's greatly going to help that, by the way, is this new test that the FDA just approved. I want to mention briefly here because this really is a game changer. Before, you'd have to have your nasal swab taken and sent out to a lab. It could take up to a week to get your results back, and it was really hampering our efforts to figure out where the hotspots were and who was sort of at risk. This new test that's been developed by Abbott Labs, I actually read up on it. It's the size of a toaster. It's actually a portable testing machine that can be set up anywhere, and a swab can be taken from the nose or the throat, and you can get results in less than 15 minutes, some cases 5 minutes, right there at the point of care. No need to send off to a lab, and so this will really increase our testing ability dramatically, and they expect to have 50,000 of these shipped out a day starting April 1st. So this is going to be a test that you're going to have to cover under your self-insured health plan, and Jen will talk about that in a few slides. But that's really a game changer and worth noting here. Also here, Cigna and Humana announced, two of the largest insurers in the country, that they're now waiving out-of-pocket costs, not just for coronavirus testing, but also for treatment. And that's a big deal, although it's only at the moment until the end of May, but it could incentivize other fully insured carriers to go this route. As for their block of business that's self-insured, they are going to allow employers to opt out of this, because obviously waiving copays really actually hurts the plan in this case, because it's more of a cost for the plan. So you do have the option, if you're in an ASO with one of these carriers, to opt out of this change, but it's a big deal and worth noting. One other thing quickly here too is one of the byproducts that we've seen in the industry that's resulted from this pandemic is the impact not just on hospitals, but also on private physician groups. Remember, you've seen a lot of orders by states that these physician practice groups cancel elective surgeries and get rid of these sort of non-emergency procedures, and that's dropping their revenue significantly. So I think when this is all said and done, you're going to see a lot of these smaller physician group practices maybe either go out of business or be consolidated, but it's having a big impact, and I wanted to mention it. Also, this study here that just came out yesterday here by Covered California, which is that state's marketplace through the ACA, they released a study about the cost of all this, and it kind of dovetails with what Ron talked about Medicare for All advocates coming out in full force here. The study that they cited basically noted the number of hospitalizations of people, because remember, this is a condition, coronavirus, that requires potentially long-term hospitalization, ventilator. It's a big deal, and the cost can be between $20,000 to $70,000 per person for severe cases. And so all told, the study here says this could throw on another 20% in overall spending for healthcare. So we spend about $1.2 trillion a year in healthcare. This alone could add 20%, and that could lead to premiums spiking in 2021. So we'll have to wait and see. There's been some calls on Congress to set up a kind of special reinsurance program to cover hospitalizations that arise from coronavirus. We'll have to wait and see how that plays out, but it's a big deal in the impact. Next slide, please, Matt. Okay, so this is what we're here for, right? The CARES Act. This is another massive bill that was just passed, and the president signed into law on Friday. It's the third round of emergency relief spending. And if we go to the next slide, we can look at what this is all about and start to break it down. Importantly here, or rather interestingly, there was a couple of last-minute dramatic plays before this actually passed, where there was one lawmaker who objected in the House to this bill passing until a quorum of members flew back to D.C. So it required 218 members to get close together in a room to pass this bill, and it kind of shows that even Congress is not immune from this. And we have to question, whether they'll be able to pass these bills in the future going forward, given that they're supposed to also be practicing social distancing. But in any case, it did pass. And if we can get to the next slide, we can go over what the impacts were. So there's really, the best way to visualize this $2.2 trillion is really an amazing amount of money, the largest amount spent in modern history here. There are 7 groups that would benefit from the money that's involved in this package. So you have individuals, small companies, big companies, hospitals, and public health entities. There's a safety net for people on federal programs, state and local governments, and finally, there's amounts reserved for education. And on the next slide, we can go over the impacts on workers a little bit more in detail. So I won't go too much in detail because we're here to talk about employers and the impact on our industry, but I'm sure most of you are well aware of the fact that cash payments will be issued for most people in about 3 weeks. I put here a little sliding scale. You can see where you would fall on that scale. The average family of 4 would see up to $3,400 in cash, which is a big deal, never been done before. And another significant part of this bill was what the Senate Minority Leader has called unemployment insurance on steroids, basically adding an extra $600 a month to everyone's unemployment claim amount, giving special relief for people that are in the gig economy who don't typically qualify for unemployment insurance. These two things are meant to defray the impact of what we saw last week with 3.2 million people claiming unemployment benefits, and that number could be even more this week. So these two things are meant to just sort of buy us some time to get through this. So are the deferrals on your tax returns and some relief here for student loans which have been deferred for 6 months. And with that, let's go to the next slide, Matt. So the impact here on employers. So this is going to really apply to many of you listening here. I'm skipping the amount of money that's set aside for large, massive companies. That's $500 billion in loans, like for example, airlines. I want to talk about small business and small companies in parts of this bill that are going to be helpful for you. The first thing here is emergency grants. So $10 billion for grants, $10,000 each to provide emergency funds to cover your immediate operating costs. So you have to show that you've been disparately impacted by coronavirus in an emergency way, and you can qualify for that money depending on the application that I believe they're going to be releasing in the next few days. The same thing here with a forgivable loan, $350 billion allocated for a special version of an SBA loan called a 7A loan, where companies can get up to $10 million per business if you have fewer than 500 employees. A couple other conditions are there, but this is a big deal because you can use this money for payroll, for rent, certain other debt payments. There are very loose qualifications here. A portion of this loan can be forgiven, which is also a big deal. But again, this is meant to make relief available to those small companies, so your clients, perhaps even you as an entity, to keep you with the kind of cash flow you need to get through the next at least 8 weeks. So that's a big deal in this package. Also some relief here for existing loans, for people who already have SBA loans, and some tax credits that are going to be, again, meant to incentivize you to keep your employees if you can, or to rehire them, put them on a paid furlough as opposed to an unpaid one. And part of these credits will cover the cost of payroll going forward. But the most meat in this bill, at least as it relates to our industry, is going to apply to the impact on employer-sponsored health plans. And for that, I'll turn it over to Jen in the next slide to talk about what you have to cover now because of this giant stimulus package. Jen?
Great. Thanks, Brady. All right. So good afternoon, everyone. I know that this has been a really exciting time, and I know last week I was just on here telling you some of the benefits that you needed to review and modify and potentially update in your health plan. Well, guess what? It is time to look at those benefits again and make some tweaks to that language that you may have been looking to add. First of all, last week when we were talking about the second phase of legislation, FFCRA, that was requiring these plans to cover the testing that was FDA approved. Now, as part of phase 3 of the CARES Act, that has now expanded the mandate for what it is that these plans must cover with respect to the testing. And still, we're only talking about the testing. So testing now has to include non-FDA approved testing. So the entire scope of the benefits that a plan is required to cover without cost sharing for 100% is anything that is FDA approved, any sort of test that is in the process of being developed in a particular state or authorized by a particular state that has notified HHS of its intention to actually review this test, and its test is for the purpose of diagnosing COVID-19. Anything else that maybe HHS has decided to be appropriate when it comes to testing based on their guidance, maybe a test from a developer that has requested or intends to request any sort of emergency use authorization. So that means you need to take a look at the actual amendment, red line, modification of your plan, and make sure that when it comes to what you are providing as a health plan for no cost sharing, that there's not a reference to FDA approved only. That modification needs to be revised. Second, how much is this going to cost? That's the second thing that plans are wondering. Now that we've expanded the scope of what must be covered, how are we going to have to pay for it? So the CARES Act actually outlines how these diagnostic tests are going to have to be paid for. And it's important to review this and see what your obligations might be. So it's either going to be a negotiated rate or whatever the publicly posted price might be as listed by the particular provider. So first, for the negotiated rate, we're talking about any sort of network agreement, direct agreement, negotiated agreement, whatever the case may be. If there is some sort of arrangement in place to pay a negotiated rate for the particular testing, that is what the rate is going to be, and that's what the plan is going to have to pay for the entirety of the public health emergency. Is there no negotiated rate? Is it an RBP plan? Is the testing done out of network? Well, in that case, it's not the time to negotiate now, but instead, the plan is going to have to pay the amount that the provider is actually listing in some publicly available website. But don't worry, the providers are required to actually publicly list this, or they're going to be subject to a fee if they do not do it. Last on this slide, let's talk about the preventive care and the vaccines. This has been a question that has come up, whether or not this testing, since this cost sharing is being waived, now means the testing would be preventive. The answer is no, it's still diagnostic. However, we know that there is in the works of being created some sort of vaccine. And as soon as that vaccine is ready, that's when we're going to have to take a look potentially at our preventive services and see if this is something that's going to have to be modified in their plans, because this is going to have to be covered at 100%. We know right now that the ACA does require 100% in-network coverage for certain preventive services that have some sort of evidence-based rating of an A or B. So when these vaccines, whenever they are available, we're going to have to cover those at 100%. And those, usually we have a year when it comes to preventive care guidelines to put those modifications into our plans and cover them at no cost. However, it looks like now we're only going to get 15 days after the recommendation has been made and it's getting the appropriate rating. So that's not a quick turnaround. That's a pretty quick turnaround time for us to be aware of when it comes to when this vaccine is actually going to be developed and available for widespread use. So we'll be monitoring that as well. Next slide. All right. The next big change here is about telehealth. This is, I'd like to say, a huge modification for something that we had been talking about, not specifically to COVID-19, but within the direct primary care context, this has come up as well. This is something that is going to be a big deal. So we know that a high deductible health plan in general is only permitted to pay for benefits after the deductible has been met, with the exception of preventive care, in order to still qualify as that high deductible status. Now, the IRS had made that modification to allow the COVID-19 testing to be performed without any sort of deductible or cost sharing and without sacrificing the HDHP status. That's great. Now, the CARES Act has actually upped the game. And now there are some additional provisions for a safe harbor for a high deductible health plan that begins on or before 12/31/2021. And that is going to allow any sort of pre-deductible coverage. So prior to the deductible being met, even though this is not necessarily preventive services, for telehealth and other certain remote care services that might be provided. And a plan that is an HDHP is not going to lose its high deductible status. And the caveat here, the way that I'm reading it as of right now, is that this telehealth is not going to be specific or limited to COVID-19 services. So this is a broader expansion of the telehealth that might actually be available for those who have a high deductible health plan. The other caveat here is that this is not necessarily a mandate, but this is permissible. This is allowed. So this isn't something a plan is going to have to do if they're a high deductible health plan, but something they could do if they want to expand the coverage that could be available to certain individuals, knowing that they may not be able to get the certain care within a hospital or going to the office of their provider that they otherwise would be. Next is certain over-the-counter medicine. So when it comes to the expansion of high deductible health plans, in addition, we're going to see some changes to the certain types of expenses that are going to be eligible or a qualified medical expense that you can receive reimbursement for or get paid for under your HSA or your FSA. And that's now including some over-the-counter drugs and medicines that an individual might be able to get. So that means that no longer are you going to need to have a prescription in order to get some sort of tax benefit treatment under your HSA, which is a change from the way that the current law is set up. Because right now, currently, you're going to need to have that prescription in order for this to be reimbursable. As of the time right now, that's not the case. In addition to that, something else that's kind of exciting is that now the FDA is going to have some authority to create some other additional regulatory system in order for the over-the-counter products that are being used to get faster treatment without having to have any sort of notice or rulemaking. So this is going to allow the FDA to actually approve changes to the over-the-counter drug administratively instead. So there's going to be this 18-month exclusivity period for these companies that are actually bringing these new products on board or to the market. They needed to put some sort of program in place to encourage and incentivize these companies to bring these things to the market. So they figured this 18-month period was really going to do that. Last is about HIPAA here. This is something to keep in mind too. It's a question that we've actually been getting a ton at Phia. It's about HIPAA and PHI and the certain modifications or changes, or whether HIPAA or PHI is no longer relevant or important during this crisis. It is. However, the CARES Act has required that HHS is going to issue some sort of guidance in the near future about how and what they are allowed to share about the coronavirus public health emergency. So we're expecting that this is going to be provided to us within 180 days, and this guidance is supposed to address, allegedly, a lot of the compliance, how to address the compliance with the existing regulations under HIPAA, maybe any sort of policies or procedures that had come into effect during this national procedure. So as of right now, there have been, HHS has allowed some waiver of some penalties that may have arisen at this point due to a hospital's failure to meet certain requirements during this emergency only. So we're hoping to get some more guidance specifically about what the impact might have been for some patients and some individuals during this emergency time. Talking about the impact on public health, let's switch to the next slide. Math, my favorite. Here are some numbers. So we talked about how huge and how massive this bill actually is, how expansive the CARES Act really comes when it comes to public health and all of the spending that we're actually going to be seeing. So specifically hospitals, this is important. $100 billion is being designated and designed for these hospitals in order to keep their health providers afloat during this situation. So I'm not sure that there's too much detail specifically right now about how this is actually going to be distributed, but it seems like right now there's going to be some sort of grant or a mechanism that a provider is going to be able to get at the discretion of the HHS secretary. So I'm not sure that there's too many restrictions right now, but other than the recipients need to be directly engaged in diagnosing or treating possible or actual cases of COVID-19. So we have to see how actually that plays out and how quickly these funds are going to be distributed to providers or others who are actively engaged in that. Another interesting distribution here is the community health centers. $1.32 billion to these centers that are working to help detect the coronavirus and diagnose it or prevent it and treating some of these individuals. And this is going to impact quite a few services. 28 million people could be impacted by this. Another interesting thing is the national stockpile. This is something we've been hearing about across the country about the lack of supplies that those on the front lines actually need. And this is granting $16 billion. And it looks like the way that this is set up, it's actually pretty broad in how it is that this is going to be able to be provided. There's no specific detail about how those funds can be used, but the goal of this distribution for this funding is in order to get that protective gear that the providers are going to need, ventilators, and anything else that's going to be necessary to treat or prevent COVID-19. In addition to that, there's another $4.3 billion for the CDC that's going to go for them for any sort of ongoing activities related to the pandemic. And this is actually available through the end of September 2024, which I thought was pretty interesting in that they are allowing this to be used not necessarily for immediate use, but over time as we actually see how things are going to play out and what it is that we're actually going to need when it comes to different services and certain individuals. So there's a lot of different distributions here when it comes to how this, the CARES Act has distributed some of this funding here. Quite a lot of money that is going to be available, and we're going to get to see some of the actual restrictions that may or may not apply and how this is actually going to be distributed to the various entities here. All right, next slide.
Hey, Jen, before we leave the CARES Act, I just want to jump in real quick for a quick note here, because this is very important to note. I'm sure most of our listeners did not review the entire bill in the previous version, but I did. And the previous version of this CARES Act, the one that didn't pass, the one that was filibustered, had a provision which would have allowed a high-deductible health plan paired with an HSA to pay for direct primary care arrangements. That's a big deal. That's something that we've been asked about a lot. Somebody slipped that into the first version of the bill, and it was taken out in the final version. So we'll be watching to see why that happened, if it may happen again. But I know a lot of our clients would love if that would be permissible to allow for the expansion of DPC. We almost got it, but we'll see about next time, and I'll follow it. So there you go.
Thank you. All right. So Yeah, last year, just a couple of clarifications that we're going to have that the CARES Act has actually qualified or caveated a bit, just to make sure we all understood. So previously, under the Families First Corona Response Act, employees of businesses with less than 500 employees were eligible for that 12 weeks of leave if they couldn't work because their children's school was closing or the child care provider was closed. And we knew that the first 10 days had been unpaid, but the rest was to be paid. So the CARES Act is actually reiterating that the employer is only obligated to pay employees up to that cap of $200 per day or $10,000 in aggregate per employee. So that is the caveat that's been changed there. And in addition to that, the emergency sick leave has also been modified. The same rules have been applied there too, that we know that it actually has been modified by CARES to ensure that that is actually also going to be provided, that the obligation is provided until the sick leave ends and either the employer has paid the equivalent of whatever the 80 hours have been, or that actual employee returns to work after utilizing that services. So we know right now too, when it comes to the FFCRA, that has been a set where there's a non-enforcement period until April 17, 2020. So we do have about 2 weeks or so, 2.5 weeks, to kind of make sure we have our ducks in a row and everything it is that we're supposed to have in place when it comes to how these leaves are being provided, how our documents, our handbooks, our plans are being written to make sure that we're incorporating that has been put into place and we're putting these policies and procedures in place. And obviously we're here to help if there are any other questions or things that might arise as it relates to what it is that you need to do as an employer for your particular plan or your handbook. And I'll switch it over to you, Phil.
All right, thank you, Jen. And of course, thank you, Ron, for the hearty welcome. So in switching over to workplace safety issues, this has actually been a very, very big issue, especially one that has been coming through our consultant lines. And primarily because not only has COVID-19 been constantly changing, as well as the guidance associated with it, but it's been difficult for many employers to find a stable source of guidance in one place. So when this initially had started and we had to be mindful of workplace safety issues, most employers were referred to the Centers for Disease Control and Prevention guidelines, which are definitely helpful, but they're fairly broad. And the agencies that we usually look to in regards to workplace safety, namely the Occupational Safety and Health Administration, the federal, and the Equal Employment Opportunity Commission, we're sending out some piecemeal information, but predominantly relying on existing or prior guidance that has been issued during other pandemic-like situations. However, finally, some good news. OSHA, the Occupational Safety and Health Administration, as well as the EOC, has provided some guidance, some additional guidance, some new guidance in relation to workplace safety. First, starting off with OSHA, they have recently released guidance on preparing workplaces for COVID-19. And this material contains mostly recommendations as well as descriptions of mandatory safety and health standards that apply during this pandemic. However, one thing that you have to be mindful of when reviewing these is, and it will say right at the top in big bold letters, these are not necessarily standards or regulations to follow, but they're best practices in order for employers to comply with the general duty clause. And I know we had discussed this in the last webinar, but just as a reminder, what the general duty clause does is it imposes an obligation on employers to maintain a workplace that is free from recognized hazards or dangers. So the one issue that many employers are struggling with in determining what precautions or what measures apply to their place is every job is different. And the good thing about this resource, it breaks down certain categories, risk zone categories, for each employer to consider when determining what precautions are necessary. And they range from low risk, which would mean no contact really with the public and no contact with your coworkers, to high and very high, which specifically applies to our health professionals, emergency health responders. One of the biggest takeaways to take from this guidance is that employers are required to provide their employees with personal protective equipment to keep them safe, depending on the job duties they're performing. However, the type of personal protective equipment is always going to depend on the risk of infection involved. So, as we had noted, for the very high exposure for the medical professionals, you're talking about an array of gloves, even a gown, a face shield or goggle, and either a face mask or a respirator. And the guidance goes down the spectrum down to the lower risk. So this is extremely helpful for, especially for employers that might have different functionalities within one umbrella that might either fall under a medium risk or that might fall under a lower risk. So also the Equal Employment Opportunity Commission has recently updated their pandemic preparedness in the workplace guidance, which is specific to Americans with Disabilities guidelines to address COVID-19. And I think the biggest takeaway there is they provide more detail on what is considered a direct threat. Now, just to give a little context to this, when there is a direct threat present to the workplace, certain rules that prohibit medical-related inquiries are basically suspended during the pandemic. So a direct threat is basically defined as an individual's medical condition that poses a significant risk or substantial harm to themselves or others. Now, it is without question, and the EOC has confirmed this, that COVID-19 is a direct threat. So in light of this, it is okay to ask employees that are physically coming to work whether they are experiencing symptoms, whether they have been exposed to COVID-19, and actually whether they have it or if they've been tested. Interestingly, under this direct threat rule, an employer can choose to exclude employees who are experiencing symptoms, as well as employees who refuse to answer those questions. So there is to sum that up, there's absolutely no right anymore when it comes to an employee coming into a physical place of work to be able to decline the kind of questions that an employer would be asking to make sure their employees are safe. So another key takeaway to take from this, however, is any kind of precautions an employer is putting into place when it comes to asking certain medical related inquiries is this has to be applied uniformly. So in order to avoid violating any of the discrimination rules under the EOC, if you're going to single out individuals to ask these questions to, there has to be a reasonable suspicion. So it has to either amount to severe symptoms. It cannot be based on any other factors besides if you were just doing this on an individual basis. So the best case scenario here, if you are still operating in a physical capacity, feel free to ask these questions uniformly. However, if you're going to specifically, single out individuals, make sure you document anything that leads you to believe why there is a threat present. So some other considerations to be mindful of is there are certain states that have what they call OSHA state-approved plans. So although these state-approved plans do have to meet the minimum federal requirements of the administration, some states have opted for and requested approval to add additional precautions. Now, some of these state-approved plans can cover either private or it can cover, state, local government workplaces, or they can cover both private employers and state government employees. So the most important takeaway there is to check with your state Department of Labor just to see if there are additional requirements on employers within that state than is required by federal law. Some of these states that are subject to state-approved plans include California, Maine, Hawaii, New York, Connecticut, New Jersey, Maryland, Illinois. So you definitely want to check your Department of Labor website just to make sure there aren't additional precautions that are mandated by the state. Also, we know this is a time where a lot of employers that are still open, or open physically, and not completely teleworking, are implementing a lot of cleaning or a lot more cleaning protocols. Now, if any of these employers are using cleaners that fall outside of the threshold of household cleaners, so if you're using industrial strength cleaners and using them more often to combat COVID-19 in the workplace, there are certain standards that an employer does have to comply with, and it's called the hazard communication standard. And basically what that requires is that employees dealing with these chemicals are given certain training as well as protective personal equipment, primarily gloves, and depending on the chemical makeup of these cleaners, a face mask as well. So you definitely want to be cautious of that. If you're using anything more than household cleaners to scrub down your office more often than you were before, you definitely want to be mindful of this requirement. So we can move on to the next slide. So obviously I had noted, in the beginning of the workplace safety issues that we have been receiving, several questions that focus on the employment end of, the workplace safety issues. So going along with these questions, one of the big ones have been because some states are implementing shutdowns where unless you qualify as an essential business, you're required to shut down unless you're able to continue work on a remote basis. So if you are required to shut down, there is no requirement that an employer continue to comply if they're covered by the FFCRA, continue to comply with emergency paid sick leave and the expanded paid FMLA. If you are closed, you are shut down, that does dissolve employer requirements during this period of time. So there is no requirement within the Families First Coronavirus Response Act that mandates an employer continue to pay these benefits, paid sick leave, or the expanded FMLA while they are shut down. So now, when if it comes to if it's not a complete shutdown, that would likely be a different story. However, if you have laid off employees, this is not intended to be, these new leave entitlements are not intended to be a replacement for unemployment. So with the expanded unemployment that is allowing for quicker payments in most states without the 7-day waiting period, this is where you would direct employees who have been laid off or if there is a shutdown. So another question we've been receiving, surprisingly, a lot of businesses are currently hiring in this environment. So, one of the questions we've received, actually we received several of these questions, is asking whether an employer can screen their applicants for COVID-19 symptoms. And the answer is yes. Again, because of the direct threat mandate, an employer clearly has a vested interest in protecting their workplace from the significant harm that has been recognized from COVID-19. So, however, this is conditional. You can't just do this to all applicants who are applying for a job. There must be a conditional offer on the table in order for an employer to permissibly request that an applicant be screened. So, key takeaway there is there has to be a conditional offer before you can screen for COVID-19 symptoms. Now, the final question, the next question, which is one we received a lot, especially dealing, with a lot of the media, a lot of employees are, basically reaching out to employers saying, I don't want to come to work. I don't feel like it's safe. So a lot of employers have been asking, is that okay? Must I allow an employee to basically refuse to come to work based on COVID-19? And the answer is that an employer is only required to honor such a request if the employee has a reasonable belief that they are in imminent danger. So what does that mean? If an employer is taking all of the necessary precautions and, they are clearly identifying any risk, if they are handling employees in the proper way that are demonstrating symptoms or have been diagnosed with COVID-19 and have processes in place to handle this, that would not likely be a reasonable belief that an employee is in imminent danger. Now, what I can say is that if an employer is not following any of the guidelines, which surprisingly, I'm sure we'll find there are some employers that are not, that could, and depending on the risk involved in this person's position, it could be a legitimate refusal to come to work. But this would again be a fact-specific finding. So I will turn this back over to Ron with some additional workplace safety questions.
Thanks, Phil. Appreciate it. Good stuff. So, one of the first items that you talked about previously had to do with what an employer can or can't require or at least request from their employees. And one of them had to do with, what can we ask our employees as far as where have they been, who have they encountered, what exposure have they had, what symptoms do they have? And it's important to remember, I think, a few things, right? The first, and we mentioned this during our previous presentation last week, is of course, you want to try and keep everybody as healthy as possible, but ultimately that becomes an impossible task when you literally can't control what people coming in and out of the office do when they're outside your sphere of influence. You can't control who's, preparing what food, who's staying at whose home. And of course, these days with most people telecommuting and social distancing, it becomes more of a moot point. But ultimately, if your goal in listening to this webinar and the previous webinar and everything you're doing is to keep everybody healthy, it's a lofty goal, it's a worthwhile goal, but it's also an impossible goal because you can't control it. If you could, then you're basically one step above a superhero. So good for you. Another goal, sort of a step down, is to at least try and maintain a productive or healthy work environment. It's sort of a step down, and that's where we're talking about things like trying to promote telecommuting, sanitizing spaces, and things like that. And then, of course, the last is avoiding liability. Ultimately, there's this feeling that if people are going to get sick, if they are going to spread the disease, you don't want to be sort of ground zero for that event. We saw that in Boston with a major employer. You're seeing it elsewhere with major employers. You don't want that bad press. So that's sort of the goal that I would say you can most focus on because it's, I think, the one that you can actually beat. And when it comes to just employment policies in general, you've already told your employees that when they're not feeling well, that they should be working from home. This is not a foreign idea. So we're just kind of taking that theory or that policy and taking it to the next level. And like Phil said, because of the current situation and sort of the designation, as a result of that, it's more of a requirement than a request, and there is some bite behind that bark. Additionally, one other thing worth note when it comes to requiring employees to report to you about exposure and symptoms is the fact that only medical service providers are required by law to actually report test results to the CDC. Now, as an employer, if you are not a medical services provider, you're not a doctor, hospital, clinic, etc., I don't know how you would have your hands on a test anyway. My understanding is they're in very high demand. So, but if you're testing somebody's temperature and they have a fever, certainly you should refer them, tell them, A, get the heck out of here, and B, go, contact a physician and find out what you need to do next, and they may want to test you, et cetera. But ultimately, that's really in the hands of the medical service provider, and the results of that test are what they're going to report to the CDC. Now, if as an employer, you have an employee or employees that are ultimately diagnosed with COVID-19 and they've been in your physical space, that's something that you may want to report to the CDC. In fact, you may be required to do so. It's not a requirement regarding reporting individuals that have symptoms and the results of their test results, but you may want to contact the CDC if there's a confirmed diagnosis of COVID-19 in your office, just to find out if there's something that they need to do with the physical space. But again, these are sort of suggestions versus requirements. Next, an employee reported contact with someone who had a presumptive case of COVID-19. What should we do? Honestly, it's interesting. The philosophy you should be applying is the same philosophy that providers are applying when most people are contacting them saying, hey, I'm not feeling well, I have these symptoms. Despite the sort of scramble for tests, ultimately many providers are reserving the tests for either high-risk individuals, first responders, et cetera. If you are not high risk and you're just displaying some of the symptoms, they're basically going to tell you, let's just assume you've got it, right? If we can test you, we will at some point. But for now, let's just assume that you have it. What are you going to do? You're going to isolate yourself, right? You're going to take care of yourself. You're going to, stay away from others. These are the things that you should be doing regardless of the test. Now, if you get the test and it turns out you don't have it, then maybe you loosen up on some of those. But in the meantime, you assume that the person has it. Well, the same thing is here. As an employer, if you're still having employees on site and somebody is a presumptive case, don't wait for confirmation. Act as if they have it. Make sure that they're home, communicate with affected workers, let them know. Everybody should be keeping an eye on symptoms anyway, but now you kind of turn that up to an 11. And that's kind of the better to be overcautious and overzealous than not zealous enough. An employee has been infected, but only found out after they had interacted with coworkers and clients. What should we do? It's interesting because ultimately, for the most part, at this point, whether it's a confirmed infection or just a presumed infection, you're more or less taking the same steps. Like I mentioned, it's better to be overzealous. Again, you're making sure that they're home. Anyone who may have been in contact with them, if they have the ability to work from home, send them home. Everyone's monitoring for symptoms. Communicate with third parties that they came in contact with. Again, be overzealous. And if you end up being embarrassed, it was actually just the flu. It's better to be embarrassed than liable. And that's sort of the policy we have to go into this. And like we've told our employees in staff meetings, when in doubt, let us know. And, ultimately don't be greedy and don't be stupid, and you'll be able to get through this. And that's sort of words to live by. So with that, we can go ahead and proceed to the final slide. Where we're going to thank you. I know during our last webinar we mentioned that the next one would be April 23rd, but this one snuck right in there. But the plan is to have our regularly scheduled webinar on April 23rd. We'll certainly discuss COVID-19, but you know what? We're going to come up with some interesting topics that have something to do with completely unrelated to this pandemic, so that you can maybe get your mind off this for at least 1 hour. Maybe we'll talk about something really fun and exciting, like Obamacare in court or something like that. Right, Brady? That'll be a good one. So until then, again, thank you for joining us. Be well, be safe, keep an eye out on things. Contact us if you need any assistance. And as always, we appreciate your patronage. Thank you so much, and have a fantastic day.